Hello, my name is Todd Koelling, and I'm a heart failure specialist at the University of Michigan. By now, I hope you've watched our video on why nutrition matters in heart failure as part of our Healthy Living with Heart Failure video series. This video contains a pop quiz. People love pop quizzes. And what essentially it does is it helps test your knowledge of following a low sodium diet, a fluid-restricted diet, and how to read sodium labels. The questions from this pop quiz come from the Atlanta Heart Failure Knowledge Test, and it's a quiz that has been used in many patients before. So without any further ado, we'll get started with questions on the limiting intake of the salt and sodium in your diet. People with heart failure can do many things to help themselves. Thinking about each of these activities and decide if they would be helpful for someone with heart failure. Avoiding salty food. The answer is yes. Avoid salty food. Should you drink lots of fluid? No. Should you stop smoking? Yes. Should you drink alcoholic drinks each day to relax? No. Should you skip your heart failure medications when you start feeling better? No. Should you know when to call the doctor or nurse for symptoms of heart failure? Yes. Which is a big source of sodium or salt in the diet? Processed foods, smoked or cured meats, table salt? The answer is all of the above. Which has the lowest amount of sodium or salt? Fresh fruits, canned vegetables, reduced sodium soup, or frozen dinners? The answer is fresh fruits have the lowest amount of sodium. Which food has the most sodium or salt? A sliced tomato, broiled fish, baked ham, or skimmed milk? The answer here is baked ham. Which dessert has the lowest amount of sodium? A hot fudge sundae, a baked apple, low-fat instant pudding made with skim milk, chocolate cake made from a mix? The lowest amount of sodium here is in the baked apple. Select the fast food with the lowest amount of sodium. Fried chicken, cheeseburger, baked potato with sour cream and chives, or taco salad? The answer is baked potato with sour cream and chives is the fast food with the lowest amount of sodium. Now these questions have to do with following a fluid restriction. Some people with heart failure are told by their doctors to limit fluids. Which of the following count as fluids? Water and clear liquids, milk, ice cream, and yogurt, Jello, pudding, and soups? The answer here is all of the above. A person with heart failure who is trying to limit their fluids may reduce symptoms of thirst by chewing on gum or sucking hard candy, cutting back on their medications, drinking small amounts every 30 to 60 minutes to prevent thirst, or warming their fluids before drinking. The answer here is chewing gum or sucking hard candy. These are questions about reading nutritional labels. Use the picture of the soup label to answer these two questions. How many servings are in this can? The answer is 2.5. How much sodium is in one serving of soup? The answer is 890 milligrams. If a person with heart failure gains 2 to 3 pounds in a few days, this usually means he or she is eating too many calories and gaining weight, has extra water in the body, needs to drink more fluid, needs to be getting more exercise to burn calories. The answer is has extra water in the body. Gaining 2 to 3 pounds in only a few days is almost always due to water weight. How often should a person with heart failure weigh themselves? Every day, every week, every month, or once in a while? The answer is every day. Thank you for listening and participating in this pop quiz, the Atlanta Heart Failure Knowledge Test. Thank you, and good luck with your heart failure